Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of 89.3 Lakes FM and Civic Center TV. In addition, today, as always, we are on Birmingham Area Municipal Access, both of our TV stations, on Comcast Channel 15 and AT&T Channel 99. In addition, we're online in HD on CivicCenterTV.com. You'll click on our Watch Live link, and there you'll be able to watch and listen to each and every show live from 10 a.m. to 12 noon as we do our live shows Monday through Friday on CivicCenterTV.com. Also, we're on a number of great community radio stations, 89.3 Lakes FM in West Bloomfield, Keego Harbor, Orchard Lake and Sylvan Lake, and of course 88.1 WBFH, The Biff out of Bloomfield Hills with leadership from station manager Ron Whittables. And we thank him and the entire team over at The Biff for helping us get on the air each and every day as we bring you the latest news and information about COVID-19 and other top stories in the local area. In addition, today we're on our Facebook page at Civic Center TV 15 on Facebook. Civic Center TV 15 is our Facebook page. Give us a like and like today's show live on our Facebook page. We appreciate you joining us each and every day on the program, as of course we continue to bring you the top stories of each and every day and talk to them with a number of well-informed guests from around the community. And today's top stories: union workers at nursing homes plan to strike. Union workers are at several Metro Detroit nursing homes plan to strike Monday as they face significant health risk during the COVID-19 pandemic, SEIU members said. Workers are calling for increased safety protections such as masks and gloves. They also want a $15 minimum wage for all service workers, an $18 wage for certified nursing assistants, and an end to mandatory overtime and short staffing, and improved benefits such as health care and paid sick leave. The Michigan Department of Health and Human Services reports that as of Friday that the state has 7,508 confirmed COVID-19 cases among residents and 3,581 among staff in long-term care facilities. The department reports 1,983 deaths among long-term care residents and 22 staff deaths. About one-third of the coronavirus cases that resulted in death in the state of Michigan so far have occurred in nursing homes. And Ronnie, these nursing home workers are at a point where they are fed up, and they've been working long hours all throughout this pandemic. It's gone on longer than any of us really imagined it was going to go on or projected it was going to go on, and they're asking for extra benefits. Many other industries have received significant hazard pay or consistent hazard pay throughout this, and now the workers in our long-term care facilities and our nursing homes are demanding a bit of the same.
This issue during the pandemic has really highlighted the what's going on in so many of our nursing homes. Number one, they have trouble getting qualified employees to even work in some of these facilities. And now this is highlighting all of the issues that they are having. So not just here in Michigan, but this is an issue across the country. And they're on the front lines every single day. They're having issues with PPE. They're having issues, maintaining, like you said, the long work hours because there's a shortage of staff. And so, if someone does test positive, then they're going to be out of work for a few weeks. So then it's going to be up to the others to kind of take that slack up as well. So, I don't know the answer to this one. I know that so many people a lot smarter than all of us are trying to address the issues of what's going on within the nursing homes, but the unions definitely are trying to address it. When I don't think it's just a matter of upping the pay, but I think it's really more about trying to come up with a solution on healthy work conditions within these facilities for the employees.
Yeah, a lot of mounting issues throughout the pandemic at nursing facilities, not just including what we've spoken about so far today in regards to those that are working in those facilities on the front lines, but also the continuing issue of COVID-19 patients in nursing homes and the results that have come from that, what many would call a mistake. Many have admitted calling a mistake in judgment from the statistics and the medical advice at the time. A lot of mounting issues that are causing continued frustration, and now it's coming to a point where they've had enough and they want change and they're demanding change, and we'll definitely keep up with that story as it continues to develop, as our union workers at nursing homes are planning to begin striking today. Other news at civiccentertv.com/coronavirus. Coronavirus cases continue to climb in the state of Michigan. More cases of the coronavirus, but fewer deaths. That's been the trend in the past few weeks in our state. The state reported 483 cases of COVID-19 and 2 deaths on Sunday. That brings the yearly total to 73,663 cases and 6,119 deaths. Last week, about 3.5% of COVID-19 tests in the state of Michigan were positive, according to the Michigan Department of Health and Human Services data. The previous week, it was about 3.4% of cases being positive. The positive percentage, a key metric for monitoring the spread of COVID-19, has been on the rise for 6 weeks. Rising number of cases is being contributed to people gathering at churches, bars, house parties, and other locations. Of course, that may be a result of the weather being better, people being a little stir-crazy after several months of being indoors, some restrictions being lifted, and people wanting to be more social during a time of the year that they normally are, and maybe in doing so, they're letting their guard down a little bit and not fighting this virus as hard as they probably should be.
One of the things we are seeing, and we've spoke about before, is that the demographic of the positive cases is shifting. It used to be over 50, and now it's at 20 to 29-year-old age group. So what's happening, the younger people are going out, living life, basically partying like there's no tomorrow, and pretending like there's not a virus out there, because I think for so many of the younger people, they haven't maybe been impacted, and when they do get test positive, for the most part, their symptoms aren't as serious as in the older population. So they're kind of throwing caution to the wind, and what's happening is when they're doing that, it's impacting the rest of us, and that we're seeing a rise in these cases.
And I think in many of these situations, the younger people that are now in this problem area, this problem demographic of new COVID-19 cases, maybe don't understand that, my symptoms aren't very severe. I'm not feeling it very badly. So, maybe my case of COVID-19 is a really minor one, and if it spreads to someone else, they'll probably have minor symptoms too. And not understanding that this is a novel virus that behaves differently from person to person. It definitely impacts older populations significantly worse than younger populations, and any sort of carelessness can help spread the disease onward. And we're seeing in many cases that lately, at least in the state of Michigan, these isolated spreads have luckily been contact traced back to a specific point, so they know where it's coming from. They can kind of take that precaution with everybody that was in that general area. But if this continues to happen, we may see a case down the line where you're not able to trace it back, because there's so many different variables and so many different places it's being spread. So the danger is absolutely there, even though the case numbers aren't necessarily ridiculously high like they are in many other states, and our death numbers and hospitalizations are low. A lot of that has come from the contribution of the shift from an older population being the key demographic of new COVID-19 cases to the younger population.
So one thing for the younger population that is out there, I know it's tiring and you just want to live life, but you have to understand this is hitting everyone. This is serious. This isn't the flu. We are not closing down the economy because of a flu. So this is very serious. So if you're not going to do it for yourself, you need to do it for everyone else. I know that the message has been out there, hey, do it for your grandmother or for your parents or your elderly neighbor. And if you're not going to listen to them, then let's think about it from the economy standpoint. And this is impacting so many businesses and so many people because of that angle. So if you're not going to do it for the health of your loved ones, then try to think of it from a different arena, and maybe that will start to get through to them.
Every person that you spread it to could potentially spread it to somebody else, and then at that point, your spreading of the virus could lead to many different many different branches of spread throughout the local community, throughout the state of Michigan, throughout the United States, and impact a large number of people's lives that maybe you're not even thinking about. So all the more reason to continue to take these guidelines very seriously. And on top of that, similarly related to that, a community spread may trigger a setback in the reopening plan. The Michigan Appeals Court has denied a request to require the counting of absentee ballots received. Oh, sorry, that's what's that? Okay, my apologies for the incorrect headline. The Michigan Appeals Court has denied a request to require the counting of absentee ballots after the time that they post on Election Day. The threat of community spread could play a major role in further changes to laws and to actions in the state of Michigan. The threat of community spread could play a major role in moving the state backward in its reopening plan. In an interview with WDIV-TV, Governor Whitmer said, while coronavirus case numbers are important, context is what really matters. If we have 140 cases in Wayne County, for example, this is from a quote from the governor, but we have a nexus, they all came out of one house party, or they all came out of one facility, then we could trace and isolate. But if those 140 cases have no nexus, then they are just randomized, and that means that there is community spread. So the governor's fear in this case isn't necessarily that we have these isolated incidents where spread comes from one location. The biggest fear now is what we saw back in March, which was community spread, where you're not able to trace where the virus necessarily is coming from. You just know that it's spreading rapidly. You don't know where it's been, and you don't know where it's going to go, and that would be the cause for great concern that makes the governor and her team at the state of Michigan slam on the brakes, turn back around, and go back to phase 3 or before.
The one thing we don't want to see happen, especially getting so close to schools trying to come up with that plan to reopen in the fall, is us seeing the spread continue to where they can't trace it back to large groups or one incident. So that makes it, when it's harder for them to trace, it seems that's what could force us back into that phase 3. And that's what we don't want to see happen, because I don't know how schools and parents are going to handle it if in the fall time we have to go back to complete remote learning, because then that's going to impact the parents and them being able to work and getting childcare for their kids.
Yeah, it's going to be really tough for a lot of industries to adjust to a setback. It's going to be really tough for schools to adjust, for schools and the families of children in schools to adjust to a setback if there's a situation where we have to roll back because this community spread is untraceable.
I wonder too, we did see where some of the high schools are actually going to have the students in the high schools be remote, but the elementary and junior high, those could be more of a hybrid situation. And I do understand that a little bit more, because it's easier to have a high school kid maybe be home by themselves during the day and you not having to worry about the childcare. But if we get rolled back into a phase 3 so close to going into the new school year, this is going to impact so many people on so many different levels.
Yeah, we already have seen some plans from local school districts to change their plans going into the fall to adjust similarly to that to avoid these kinds of issues. All of that and more making headlines today and every day at civiccentertv.com/coronavirus, where we have the top stories of every day for you on our website, and we have links to resources from your local municipalities, from Oakland County's coronavirus COVID-19 page, from the state of Michigan's coronavirus page, and the Centers for Disease Control and Prevention's resources related to COVID-19 as we continue to cover this major issue in the state of Michigan and definitely in the Oakland County area as the COVID-19 pandemic continues on. And to talk about that more on a local level, we're joined by our first guest today. Chief Greg Flynn joins us once again from the West Bloomfield Fire Department. Chief Flynn, thank you for being with us today.
Good morning.
We appreciate having you on. How are you? How are your firefighters doing?
Well, I'm doing great, thank you. The team here at the WBFD is doing well. We continue to, again, evaluate kind of our status here in the whole COVID response, which we're really moving more into a COVID as part of our daily activities. I think we've moved closer to a, hey, this is the routine. This is what we're doing. folks aren't nervous now when we're showing up in masks. In fact, they're glad to see us in masks. We're glad to see that when a caller calls 911 and they have their face covering on when we arrive. It shows a great deal of respect to the responders and a great deal of respect to our community. And we're grateful to the many, many, many residents that are doing the right thing and taking some civic responsibility to mitigating COVID spread within West Bloomfield, Orchard, Kego, and Sylvan.
In recent weeks, as businesses have reopened and as businesses now have had to readjust with the governor's mask order, how critical has education to the outward community, particularly the business community in West Bloomfield and the areas that in the Tri-Cities, been for your team at the fire department? How critical has it been for other fire departments locally to inform these businesses of best practices as they work to enforce these issues and put their best foot forward to provide safe environments for their customers?
Well, good education, I think, is the qualifier there, Tyler. There's so much information out there, and I heard, some of the build up here for the show and the headlines there as you guys started off the program today. So much information out there and so much misinformation. So much information that is portraying everybody as wearing masks that's going to protect them from getting the disease, not understanding the physical barrier that a face covering provides as of just a permanent covering your cough type approach. What physical distancing really is trying to do, which is when someone doesn't have a mask on and they can't cover that cough, that the physical distance is part of a mitigation strategy. So much of this discussion is turned into what I have a right to do or what I can do. And, I won't engage in this argument with folks. You can do destructive things. You can do things that are hurtful to our community. I get that. I understand that. What we want to engage with, and I think what so many businesses want to engage with, are residents and customers that want to take some personal responsibility, some civic responsibility, so that truly this hashtag "we're all in this together" means something. And we're doing it here. I want to highlight, one of my highlights of the day is lunchtime, right? And so we have, as a staff, tried to get out more in the community. And I can tell you, if I go into Jersey Mike's to get a sandwich, the staff has on their face coverings. People have on their face coverings. If I walk in with the FD staff and the staff there is working and someone comes on and they don't have a mask, we might give a gentle reminder like, hey, if you forgot your mask, go grab it. Or, if we can keep our distance. If you're not able to wear a mask, just be respectful of the staff. We can find our way through this in a very kind and helpful way throughout the community. So I think that education is important, and making sure that people aren't reading misinformation that masks and face coverings are this harmful thing to the masses. It's a false narrative, and it's something that we just need to move past. We don't need to give it a bunch of time to discuss here. We just need to continue to reinforce what right looks like.
Chief Greg Flynn with us from the West Bloomfield Fire Department on the Oakland County Megacast on a family of TV and radio stations. In terms of capacity, there are capacity limits at a lot of these places, and they've rearranged how these businesses have had to rearrange in many ways how they have their stores aligned and how they have their stores ready for the public to come in. How influential has the fire department been in helping them continue to modify that, so not only do they have safe spaces for COVID-19, but in the event of other hazards such as a fire or a medical emergency, that it's still the most opportune situation for responding to that emergency?
Well, I do want to take a quick moment here just to highlight an event that took place this morning, Tyler, as we talk about safety. We did have a small structure fire this morning that was contained to a small room in a lower level of a home. And I want to highlight exactly what the residents did. Their smoke alarms went off. They called 911. They got out of the house. They stayed out of the house. Fire department responded very quickly, extinguished it, and everybody is safe, and we're moving forward. I share that story with you because that approach, what I just explained to you, has been a proven strategy for mitigating fire spread within a structure. What we're talking about here today is how do we prevent the spread of a virus? And there are very, very simple things that we've been saying since day one of this show. Since day one, wash your hands, keep some physical distance between you and others when you're not able to cover your cough and you're not able to wear a face covering. If we do those things, we can mitigate that spread. Just like when we do the things with fire attack and keeping the fire from spreading, it works. It works. And so our smoke alarm, all of these statistics I have up on my screen in front of me that's showing you the zip code for Oakland County. And I know you guys have referenced this from the Oakland County dashboard. We're in it. West Bloomfield, the Tri-Cities, we are in it. We are some of the darker shaded areas showing the higher density on the map. And we, I think, are going to get through this best when we put aside some of the false narratives, some of the misinformation, and we just continue to go forward with good strategies. So those business owners need our business. We want them to survive. So I'm going to do the right thing, and I'm going to wear my mask. I'm going to do the right thing not as a first responder, but as the fire chief going out to lunch with other staff, just like staff all over our township within their different places of employment. When we get into the vehicle, all of us in fire administration, we all put our masks on the way to the vehicle if they're not already on from being in the office. But we come out of our individual workspaces because we're going to be in a confined space now where we can't respect some physical distancing. Tyler, I feel like and Ronnie, I feel like it's this repetitive record that almost sounds broken, and we're losing our audience because they're tired of hearing the same thing over and over again, and that they feel it's not working because the numbers are starting to go up again. And I want to push back on that. It's not that it's not working. It's just that we're not all doing it at the same time. Florida is feeling what we were feeling back in the middle of March, right? Yep. The headlines, the interviews, the stories feel like deja vu, with ERs becoming crowded and doctors and nurses at their wits' end as far as availability of PPE. We've heard this story before. We've lived through it. And so different pockets are always going to pop. A Northern Michigan outbreak, they're going to feel that pain. We've been through. Why would we want someone to have to experience that again when we can simply do hand washing, physical distancing, and cover our cough and anything coming from our mouth and nose with a face covering? It's so simple, but yet we're making it so very difficult.
Chief Greg Flynn from the West Bloomfield Fire Department with us on the Oakland County Megacast. Chief Flynn, just a few more minutes with you before we got to let you go. In terms of other common safety issues that we see over the summer, whether it be on the water, whether it be in the home, whether it be just in the general areas of the public, what are some common issues that you run into as a fire department from the community over the summer months that people should maybe be more aware of now to keep themselves, their families, and others safe?
Well, we always want to emphasize the need to go over your escape plan with everybody in the home. And you're never too young or too wise to review your escape plan. And remember, 2 ways out is an important part of that. And your meeting place, once you're outside of the house, that is by the big tree in the front yard or somewhere away from the driveway or the road. Because remember, those emergency vehicles are going to be coming up very quickly to your house, and we don't want you standing in the road. So I want to start there. Other things that come up, the safety on the water is paramount, making sure that people have vests. I know there was an incident on the water up in the northern part of the township, up in the Tri-Cities area over the weekend. And we just want to make sure that everybody is aware of the responsibility that comes with enjoying the water. And all of us play a role in that. All of us do. So even when we see another boater in distress or something, we play a role in keeping the community safe. And then I guess the third point is as we're running different pieces of machinery or heating, cooling systems and things like that in your homes, making sure that all of those are ventilating. You're changing your air filters in your furnace because your air conditioning is running through there, and we want to keep that air flowing and making sure that belts and fans aren't working any harder than they have to, because those are the things that start to burn up or work extra hard and smoke up and spread the odor through the house. And someone will call in what we call an odor investigation, where they smell something burning in their house. 2 spots we usually check: dead flies on top of those old halogen lamps with the light bulb that used to face upwards, and the dishwasher for something plastic that's fallen onto the heating element. Those are 2 go-to spots for odor investigations. And after that, we start checking furnaces and other places where people have power strip plugged into power strip, plugged into extension cord. bad ideas. Those are the things that usually we run into a problem with, even in the summertime.
Chief Flynn.
Chief, if I could ask you a quick question, because I was on the lake this weekend and it is packed out there. When people are on the lake or they're on the sandbar, how do you convince them to keep their social distance and to wear a face mask in those types of situations? Or is that okay not to because they are outside?
So I think the way we need to phrase some of that, Ronnie, is we need to say that we want to mitigate risk. So I think too many of our conversations are taking place in absolutes. So the different risk thresholds some of us have, we all have different risk thresholds. And what we're saying is that outside your risk becomes lower because there's more airflow and in theory, less likelihood of disease transmission because the virus has so many different directions to go as compared to you and I sitting in the studio across the table from each other, just 1 foot apart. Now your risk threshold rises. We want to mitigate risk, meaning we want to make it less. So can you do it on the sand? Can you mitigate risk on the sandbar? I think you can. Now I don't frequent that. So I'm guessing from your description that there are just so many people. And that's where this comes in. Maybe you spend a little bit of time on the sandbar, an hour or so, and then we make room for someone else to come out and enjoy it because we can't mitigate risk if we're all on the sandbar. And so we've got to come up with some strategies as a community. And I think that's where people want government to step in and say, you make the rules. And that's where I guess I'm just asking for citizens to say, we know what's going on here. Let's us figure this out. We don't need someone to come out and necessarily police what's happening. We need to start saying, hey, let's share this resource because we know we can't all be here right now because that puts our risk level too high. And we don't want to put our community at risk. And I hope that ownership will help move us into some better decision making. But I guess more directly to your question, Ronnie, I think that becomes a very difficult nut to crack because you get such a short boating season in Michigan, and the weather has been wonderful for boating, right? So everybody wants to do it. And who's going to be the one to say no to that? And then that's where conflict comes in. And now I think we take our risk level and go even higher for other things within the community. So I'm not trying to dodge your question. I'm just saying that we need to create more personal ownership in how we're going to enjoy some of these very valued spots within our community. But we have to do it differently. And I would leave it to those folks that have the most experience there to come up with some of that. Quit just throwing it in our face and say, we just can do it. We know you can do it. What we're saying, is it worth the risk to our community? And many of us are saying overwhelmingly, no, it's not worth it. We can do better.
Chief Flynn, thank you for being with us today.
Oh, you're very welcome. Thanks for having me on.
Appreciate it. Chief Greg Flynn from the West Bloomfield Fire Department with us on the Oakland County Megacast. We're going to take a quick break. When we come back, we'll talk about the continued social justice movements all across our country, as well as the impact of two great leaders that we recently lost. You are watching and listening to the Oakland County Megacast on our family of TV and radio stations. Ronnie and I will return after this break.
Michigan, we still need to stay careful because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19. To make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/contain-COVID. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of 89.3 Lakes FM and Civic Center TV. In addition, today, as always, we're on Birmingham Area Municipal Access in Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin, as well as 88.1 WBFH, The Biff. 88.1 WBFH, a service of the Bloomfield Hills School District with operations out of Bloomfield Hills High School, right there in the lobby. You can't miss it. Great community television and radio stations we have with us on our Megacast family of stations each and every day. Today, in addition, we are also broadcasting on our Facebook page on Civic Center TV, facebook.com, Civic Center TV 15, and you'll be able to watch today's entire program there after the show is over, as well as while it's live. And we thank you if you're tuning in live on our Facebook page via Facebook Live, as we are now joined by Oakland County Department of History Professor DeWitt Dykes to talk about some historic figures in American history that we have recently lost and their continued impact on social justice movements we are seeing today. Professor Dykes, thank you for being with us today.
My pleasure. Thank you.
How have you been since we last spoke? It's been a few weeks.
Quite well, staying home and wearing masks when I go out.
That's good to hear. That's what we like to hear here. So over the weekend, we, of course, we've recently lost a couple of iconic civil rights leaders in the United States, and Reverend C.T. Vivian, and of course Representative John Lewis. Could you give us a little bit of details, particularly on the impact of these two figures in the civil rights movement and how they've impacted the movements we're seeing today?
Well, both Lewis and Vivian and someone else who died about a week or two earlier, Reverend Joseph Lowry, all three of them spent much of their adult years campaigning to get rid of segregation, racism, and to bring equality to African Americans and others. And Reverend Lowry died just a few weeks ago, and he was a Methodist minister, and he worked hard to help. First of all, he supported the Montgomery bus boycott when Martin Luther King was the leader of it, and he also joined the Southern Christian Leadership Conference when King started that. And he eventually became president of the Southern Christian Leadership Conference several years after King died. And he made enormous contributions, but he's not as well known because he didn't get into the limelight in a certain way. But Reverend Joseph Lowry, who was a Methodist minister, Reverend King was a Baptist minister, John Lewis, who was C.T. Vivian, who was a Baptist minister, and John Lewis, who had planned to become a minister but never got through the training or the education to be a minister, but who worked hard in a ministerial capacity, so to speak, in helping try to get rid of racial segregation, discrimination, and bring equality to all people. And Lewis has received more attention, though Vivian and Lowry did see a good deal of attention, but Lewis has received more attention because of the physical, personal sacrifices that he undertook. First of all, he was involved in sit-in demonstrations in Nashville. He then got involved in the freedom rides, going from the upper part of the South through the South and all the way into Mississippi. He was jailed many times in Nashville, in Mississippi, and many other places. He had his head cracked in Alabama by Alabama State troopers. And he was just an example of determination to keep testifying and keep campaigning for improvement for civil rights for African Americans. And he felt that if African Americans could get equal rights, then other groups, Native Americans, women, and others could follow suit and get equal rights on some of the same principles.
DeWitt Dykes with us. He's a professor in the Oakland University Department of History with us on the Oakland County Megacast. Professor Dykes, John Lewis has often been referred to, Representative Lewis has often been referred to as the conscience of Congress. He's been involved not only in, of course, the civil rights movement and movements for more equal rights for African Americans and for other people of color, for Indigenous Americans as well. He's also been involved for other marginalized communities. He helped lead the sit-in in the halls of Congress and after the attacks on the nightclub in Orlando in support of the LGBTQ plus community. And he's, as I said, been referred to as the conscience of Congress. What about Representative Lewis and his style of leadership and his ability to communicate with people and bring people together made him so trusted by people of all different points of view and all different political affiliations?
Well, first of all, people respected the fact that he had physically gone to jail, that he had his his skull cracked by policemen in the attempted march across the Edmund Pettus Bridge, that he never gave up trying to improve things for others, not merely for himself, not merely for African Americans, but for others, LGBTQ community, for example, Native Americans and others. And he always wanted things to be better and improve it, and he was willing to sacrifice. He was also active in the campaign to free South Africa from minority white rule. He was arrested numerous times for being involved in demonstrations in many, many different areas. And he spent his adult life from the 1960s until just recently campaigning for improvement on some issue and something to make other people have a better lives and to make the United States of America a better place for everyone to live. So he truly sacrificed his life, and he did a lot. And he was both a symbol and an active participant in efforts to improve things.
Professor Dykes, we've talked before about this, but we see so many similarities between the civil rights movements of the 1960s and forward from there and today's Black Lives Matter movement as well. And even though the protests necessarily aren't being consistently shown on national news anymore because there's not fires and there's not people that are looting and all those other situations necessarily that we're seeing much anymore, but these protests are still very much ongoing. And one thing that was really preached by Representative Lewis throughout his career in politics and in social justice movements was starting good trouble, as he called it. What is good trouble, and how does what we're seeing in the Black Lives Matter movement now as people continue to march throughout cities peacefully throughout the country, how does that mirror what Representative Lewis was talking about with good trouble?
Good trouble essentially means that some of the things that may be not gentlemanly or ladylike that you have to demonstrate, you have to disrupt normal procedures in various bodies, whether it's city council, Congress, or some other place, that you don't just politely say we wouldn't want this, but demonstrate, sit down, interrupt, and yes, you'll get into, quote, trouble by being arrested, by being told you're not following the rules. But what John Lewis and others tried to say is, as long as there's discrimination against LGBTQ people, against African Americans, against women, and against Native Americans, then somebody, and as many people as possible, should go out and demonstrate, get arrested, get their heads cracked if necessary, though he didn't recommend head cracking, but do whatever is necessary to say, we can't keep going on as usual. We need to have some change, and to demonstrate and put your body in the way, and if necessary, get beat up, arrested, and become someone who says we can't keep going on. The death of George Floyd was tragic, but Eric Garner had the same thing a few years before that, and there are numerous other cases. And what has often happened is that the police who've been trained to deal with bad situations, violent people, armed people, shootouts and all that, they can't seem to understand that under certain circumstances that people, that African Americans especially, are not necessarily automatically guilty of something. And even if they're guilty of driving with a broken tail light, such as in South Carolina, or accused of passing a phony $20 bill, that they still need to be treated with some dignity and respect, and to avoid killing them. And in so many cases, whether it's George Floyd or Eric Garner's being in a chokehold of some sort and being killed because they can't breathe. But what did either Garner do or George Floyd do that deserved their death? $20 bill passed. Well, if he did it, we don't know if he did. But if he did it, then a court case should solve that. And likewise, Eric Garner for selling loose cigarettes, not paying taxes on it, his life is not worth that. But unfortunately, some police have misunderstanding and misuse of their power. And when it comes to very serious situations like armed individuals who are shooting at either others or the police, then certainly the police need to use some form of force. But when citizens who are accused of driving with a broken tail light, as in South Carolina, or passing a phony $20 bill, for example, or selling cigarettes, or the case in Louisville, Kentucky, Breonna Taylor, where she was minding her own business, and apparently the police had the wrong address and busted in without identifying themselves and wound up killing her, and her boyfriend used his gun to shoot back. But the police seem to be out of control in many cases, not all of them. Many of them do excellent service, render very good things to the community, but there are some who feel that their badge and their training is a license to kill, and many of them have what we call implicit bias. They assume that if a black person is accused of something, they're guilty, and anything they can do to arrest and apprehend them is okay. But George Floyd was handcuffed and then put on the ground. There's nothing he could have done to get away from 4 policemen, and he wasn't trying to get away. So there are times when the police feel that anything they do is justified because African Americans are suspects, and African Americans will somehow don't deserve the same treatment as if it was one of their relatives. So the police often has been seen as an occupying force in the African American community or in any community that African Americans wind up in.
Professor DeWitt Dykes with us on the Oakland County Megacast.
Professor, if I could ask you a quick question. You yourself have been a great mentor to so many people. What advice do you give to these young protesters to take it from the streets to policy? How can they make lasting change?
Well, first of all, they need to draw up a set of goals that they have in mind, hopefully goals that will be reachable. They might want to set up goals that they would achieve in stages. An immediate goal, change police tactics. The slogan, defund the police, might need to be redefined to say, take some of the police budget and put it into social work activities. So they need to have clear goals at both the local level, and if they are organized to the state level, and certainly at the national level. They need clear goals, and then ideas on how to accomplish those goals are very important. Any group, whatever it is, needs something more than a slogan and a title. And the Black Lives Matter group has done an enormous amount to call attention to mistreatment, but they do need specific goals and specific strategies, and probably a little more coordination within a state and maybe a region and also nationally. Well, one of the things about John Lewis is that he and other students formed the Student Nonviolent Coordinating Committee in spring of 1960. And Ella Baker, who worked under Martin Luther King at the Southern Christian Leadership Conference, it was her idea that all the students are having sit-in demonstrations at lunch counters and they're acting independently. It would be good if they could organize and coordinate their activities. And the Student Nonviolent Coordinating Committee from 1960 to 1965 was an enormously effective organization. They went into small towns and lived among the people and helped the people first identify their own goals and then organize the group and then decide what methods they would use to try to achieve their goals. So they were centered toward helping local people with self-definition and self-actualization. And Black Lives Matter, as I understand it, is a decentralized organization, but they need some goals, specific goals, and some coordination, and to work at each level, local, regional, state, and national together. So that would be what I would say. The Student Nonviolent Coordinating Committee and other groups proved to be successful in the short run, but to wind up going out of business, shall we say, ending their activities after a number of years. And Black Lives Matter can either, if it can accomplish some of its goals, then it's okay to go out of business. But it's very important to define and to proceed and to work together.
Professor DeWitt Dykes, a history professor from Oakland University, with us on the Oakland County Megacast. Professor, we've talked a lot about the various leaders that we've lost in recent weeks, particularly over the weekend, Reverend C.T. Vivian and Representative John Lewis. What is something that everybody can learn from these leaders, regardless of their racial background, of their socioeconomic background, their political background? What's something that each one of us can take as a lesson from the lives of these great leaders and use that to go forward and create necessary change in our society?
Well, the basic idea of Reverend Vivian, John Lewis, and also Reverend Joseph Lowry, who died a few weeks before, all of them worked hard to identify what needs to be changed, who is trying to work on changing it, to come together, support those persons who are trying to make these changes. First of all, define targets that need to be addressed, and then also some method of trying to do it, and to obstruct normal functioning. That's the good trouble that John Lewis was talking about. If a lunch counter won't serve African Americans, then let's go sit in and demand they serve it. And not only plan, but know what your rights are under the circumstances. So dedication to improving society, to helping a wide range of people, to trying to form coalitions with others who either understand and or who are also disadvantaged in some form or fashion. Those are the basic ideas. And if you can't get city council, state government, county government, or the nation to pay attention to your specific demands at the moment, figure out how you can get something started and also coordinate with others. Planning, orchestrating with others, joining others, and seizing the right moment, finding the right moment to make your demands. These are some of the goals. And never give up, and don't worry about being ladylike or being gentlemanly. Try to stay within the law, but if you get arrested and go to jail, fine. John Lewis and others were arrested many times. John Lewis and the Student Nonviolent Coordinating Committee, they believe jail, no bail. If you put us in jail, we'll stay. And the longer we stay, it'll call attention to the injustice we're campaigning against. And so that was how Lewis, Diane Nash, many other students, even the mayor of Washington, D.C., I forget his name right now, but the former mayor who just died, but he was, they went to jail and stayed there until in some cases, the people put them out of jail because they were getting too much publicity being in the jail. So Marion Barry is the man's name I was trying to think of. But he came out of the SNCC movement in Nashville Student Movement in 1960, and then other Student Nonviolent Coordinating Committee movement beyond that, before he settled in Washington and became mayor.
Well, Professor Dykes, we thank you for being with us. You're so gracious with your time and your knowledge, and we always learn something having you on here each and every time we have you on the program. We appreciate having you on today.
My pleasure, and let me know when you need more information.
Absolutely, anytime. Thank you very much. Professor DeWitt Dykes from the Department of History at Oakland University with us on the Oakland County Megacast. And as always, you just learn so much about history that you're not really getting out of a textbook or out of a lecture necessarily from Professor Dykes, as we continue to dive into the movements we're seeing today and their similarities to movements in the past, and learning about our leaders and the impacts that they've had over the course of their lives and what we can take from them in our modern society as a whole, not necessarily if you're leading a movement or if you're part of a movement, but just in general, in order to create a better world.
It's so important for us to understand the history and to take lessons from the history and what has happened to help move us forward. So to have someone like the professor with his knowledge is such an asset to the community as well as the students over there at Oakland University.
Yeah, especially, and in these times too, where we have so many similarities to the past, particularly the civil rights movement of the 1960s and beyond. It's so important to recognize those similarities, recognize the differences, and recognize what effective leadership looks like. And we definitely saw examples of that throughout the lives of Reverend C.T. Vivian, Representative John Lewis, and others that Professor Dykes had spoken about as well. We're going to take a quick break, and when we return, we'll talk about the upcoming elections. Oakland County is putting forth a lot of effort to make sure that these elections happen safely and securely, and our local municipalities are very hard at work to make sure your absentee ballot votes count in this upcoming election. That coming up in just a moment. We'll be back on the Oakland County Megacast on our family of TV and radio stations. Ronnie and I will return after this quick break.
Hi, I'm Dr. Jonay Khaldun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dalton in the studios of 89.3 Lakes FM and Civic Center TV. In addition, also on Comcast Channel 15 and AT&T Channel 99 today, as every day Monday through Friday from 10 a.m. to 12 noon on our program. We're joined by Birmingham Area Municipal Access in Birmingham, Bingham Farms, Beverly Hills, and the Village of Franklin. And today, as always, on two great community radio stations as well, 89.3 Lakes FM and 88.1 WBFH, The Biff. Joining us today and every day, we thank Ron Whittables for getting us on the air and keeping us on the air at Bloomfield Hills High School, their place of operation, Monday through Friday, 10 a.m. to 12 noon on this, the Oakland County Megacast, where we talk about a variety of really critical topics during the COVID-19 pandemic and other big news from around the Oakland County area each and every day. And as we're approaching August 4th, and definitely as we're approaching November, there are a lot of concerns about our upcoming elections. Are the polls going to be safe with COVID-19? Are your absentee ballots going to be in time and be counted with new rules and regulations? And to talk about that and other programs going on in Oakland County to help make this election as effective as possible, we're joined now by the Oakland County Clerk and Register of Deeds, Lisa Brown. Lisa, thank you for being with us today.
Oh, my pleasure. Thanks for having me, Tyler.
Appreciate having you on. How are you? How's your team been during all of this?
We're busy. New challenges with trying to get an election run during a pandemic, but we'll get it done.
Last week it was announced with, of course, yourself, County Executive David Coulter, and others of local clerks from around the local area, the Oakland County Democracy Initiative. Can you give us a little bit of an overview about what that initiative is and how it's going to help make this election effective and safe for our Oakland County voters?
So that was a committee formed by our chair of the Board of Commissioners, Dave Woodward, and with local clerks, people from interest groups, and then our director of elections, Joe Roselle, served as vice chair, and then one of the commissioners served as chair. And they talked about different issues that election administrators are facing with this election in the pandemic, and what could the county do to assist in ensuring that everything goes as smoothly as possible. And so the press conference we had last week was announcing the initiatives. One of them is, I guess I'll call it like a hazard pay, a bonus pay for election workers this August. On top of what they would normally get, they will get an additional $50 supplied by the county. We purchased a lot of equipment at the county. There was a new bill that was signed into law that allows local municipalities to contract either with one another or with the county to process their absentee ballots. And I have signed many agreements, 16 agreements for August that we will be processing. So this is brand new, processing absentee ballots on behalf of our Witt partnership with those municipalities. And so we had to get extra equipment for that. And so there's a slew of things that we're working on to make sure that everything runs smoothly, that results come in a timely fashion, all those sorts of things.
And Clerk Brown, you want to make sure that people that are voting absentee, especially during this pandemic and with the new constitutional amendment allowing no reason absentee voting, that you're going to see an influx. We're already seeing an influx of people that are registered to vote absentee and have received their absentee ballots. And now there's maybe there's an added concern of getting those votes in and counted with new regulations that say that these absentee votes are not going to count if they are not into their precinct by the time that the polls close on election day, both for the primary and for the general election. Is there anything else that you and your office and other clerks and municipal clerks in the Oakland County area are working on to help curb that issue and get these votes in, make sure that our absentee voters, especially with the influx of them that we're going to have in this election, are going to have their votes counted?
Yes. So first of all, that's another part of the initiative is a voter education piece to the puzzle. And, in August, it's different. How you have to vote your ballot is different than in November. And in August, just like with the presidential primary, that's a different one too. So, but in August, you can only vote one party. So if you split your ticket, this is not the time to do it. Otherwise, none of that section will count. So this is something I want to remind voters of. Pick a party, and then when you flip your ballot over, you have to stay with that same party. But there's also a nonpartisan column. So vote that too. And use a blue or black ink pen. Now, as far as getting your ballot in time, I encouraged our local clerks to have secure, large outdoor drop boxes, so you don't have to worry about the Postal Service, because we know they're overburdened with this as well. So I know in talking with Debbie Binder, our West Bloomfield clerk, that I know she had ordered one, and when I was talking to her, I'm like, why don't you get another one? And so I know she put in an order, and the Secretary of State actually was offering to pay for one drop box for each municipality. So people should look for those in their community as well, or contact their local clerk's office to see if they have a drop box and where that drop box is, and that will help ensure that you get it there in time. But also on the Secretary of State's website, there's something that we call an absentee ballot tracker, and I actually have a link to it on my website that you can see where in the process your absentee ballot is. So I know people, are concerned. I requested it 2 weeks ago. I haven't received it. Did they get my request? Or I mailed it. Did they get it? All those sorts of things. And one last thing, probably not last, but one other thing, when you do return your absentee ballot, make sure you sign that outer envelope. That is key. Otherwise, again, your ballot isn't going to be counted. And hopefully, if you forgot that, your local clerk will be reaching out to you saying, you need to remedy that. But make sure you sign that outer envelope. Use a blue or black ink pen. only vote one party, stay with that same one party when you flip over your ballot.
Lisa Brown.
It's a
with
lot
us.
to remember.
Oh, yeah. Oh, it's a lot. Lisa Brown with us. She is the Oakland County Clerk and Register of Deeds with us on the Oakland County Megacast. And we've talked with other clerks before about this. Many people are voting absentee in this election, either by choice or out of an abundance of caution with the pandemic. But many people, myself included, we tend to be voters that like to vote in person at the polls. And there's a lot of concerns there, and myself included, with poll voting this year with the pandemic still very much in mind, and definitely going to be a factor in August and potentially even still in November. What measures are being taken from the county level down to these municipal clerks and these precincts to ensure that these facilities remain safe during the election, both for the election workers and for those that are filing in?
Well, precincts are under the purview of the local clerk. But I will tell you again, the Secretary of State has said that they're providing PPE, so masks, that sort of thing, for the precincts. It is suggested, or more than suggested, that voters do wear a mask when they go to vote. You know, another thing you could do is bring your own pen. So again, a blue or black ink pen, if you're worried about touching a pen that somebody else has and it wasn't sanitized. And I know our local clerks are all working on ensuring that everything is safe as possible. Sneeze guards, all those sorts of things in our precincts. And I'm actually part of Vote Safe, which is a bipartisan coalition that believes and wants to ensure that everyone has the right to cast their ballot safely, whether it be in a precinct or by absentee. So, there's a lot of people working on this issue. And yeah, there are going to be people who want to go to their precinct on election day. And like I said, masks are, we would like people to be wearing masks. The poll workers will be wearing masks. There'll be hand sanitizer. We're going to be asking people to sanitize like before and after probably. And just all these different measures that you're taking really when you go anywhere, when you go to the grocery store, it's the same sort of thing. So, just common sense things that we have now kind of implemented as our everyday life when you go to the polls.
Do you anticipate there will be fewer polling places open this upcoming election?
No, not right now. So not for August. In May, so we didn't have any May elections in Oakland County, but other counties in Michigan did. And what came down from Lansing was that each municipality had at least one precinct open. But this is a different election. It's a bigger election, obviously. And there has been no hint of that. And now we're so close to the election that we'll have every precinct will be open. And I guess I would like to put in a plug if anybody wants to work. I know that our local clerks are always looking for workers, as well as we are for our absentee voting county board that we're doing this time in August. We're always looking for people to work in the polls as well. So you do get paid for it.
Are we experiencing a shortage in election workers? I know that before it's been kind of a struggle, particularly from my communications with the West Bloomfield Township Clerk, Debbie Binder, in past elections, that they're always looking for new people and are trying to get more people to work these elections, especially with the critical election year that we're in right now and the situation we're in with the pandemic. Are you noticing that we're still having a bit of a struggle to bring in new election workers to fill those gaps?
It's not just even bringing in new people. It's the people that are seasoned maybe are hesitant about working. So a lot of our workers are seniors and, may fall into a category that puts them more at risk for COVID and just aren't feeling comfortable. So so I guess in that regard, new, but we're always, I think everybody's always looking for poll workers. And, as technology has changed and everybody now uses the electronic poll books, I think our local clerks would love to have some, younger workers as well who are more computer savvy and that sort of thing. And so it's a good gig for a day to, you have to get trained first, get your certification, and that takes a few hours. And then it is a long day, I'm not going to lie. But, you are an important part of the democratic process when you do work in elections. So I encourage anyone who may be interested to either reach out to their local clerk or, with my office, we have our application online on our website if they're interested in working on our absentee counting board.
Lisa Brown with us, the Oakland County Clerk and Register of Deeds, on our family of TV and radio stations on the Oakland County Megacast on 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. Lisa, just before we let you go, anything else you'd like to touch on today?
Well, I just want to make sure that everybody remembers that the election is coming up. And I think you already mentioned this, Tyler, but yes, your ballot does have to be received by 8 p.m. on election day. So we do want to make sure everybody's vote counts. It's your right to exercise, and you should use your voice and make sure you cast your ballot and get it in on time. Like I said, if you're voting absentee, sign that outer envelope, whether you're in person or by mail, blue or black ink pen. Like I said, we want everybody's vote to count. You're taking the time to fill out that ballot. We want to make sure it counts.
Lisa, we appreciate having you on today.
Thanks for having me.
Oakland County Clerk and Register of Deeds, Lisa Brown with us on the Oakland County Megacast. And Ronnie, a lot of concerns with this upcoming election, understandably so, for the local voters and for voters across the country, with the pandemic still very much looming over us and with the various concerns of polls issues and other primary elections throughout the country. And it's good to see that Oakland County and these municipal clerks are working together to solve these issues, because it may not be something that can be solved on a clerk's department to clerk's department basis. It's going to be a team effort to tackle something as critical as an election during something as critical and critically challenging as a pandemic.
On top of this, they are expecting this is going to be a very busy upcoming election with more and more people exercising their right to vote, which is adding in to some of these issues and how we are going to be addressing them. So really take your time, do your homework. You can always get a pre-look at your ballot as well online. They put that on there so there are no surprises for you when you get to the polling place, if that's how you choose to cast your ballot, so you can get in, get out much faster than seeing it for the first time if you want to take advantage of that. But again, it's those little things of making sure you do sign it with blue or black ink if you are going to do the absentee ballot, or signing that outside envelope. Those are the situations that you want to make sure that you're paying close attention so that your vote does count.
A lot to keep in mind for this upcoming election. We have more details on that as the election comes closer. We'll aim to talk to more municipal clerks this week about what they're doing in various municipalities to collect absentee ballots and to make sure that those precincts, which are, as Clerk Brown had mentioned, ran by the individual municipalities, are safe. We'll hope to talk to more of them this week, and we're reaching out. Other big issues today, we saw many stories over the last several weeks about issues in senior living facilities and senior rehab facilities as well, and that includes one of our top stories today. And joining us to talk about senior issues and senior care issues now is a certified senior advisor from Care Patrol of Oakland County. Kari West is with us on the Oakland County Megacast. Kari, thank you for being with us today.
Thank you, Tyler. Thanks for having me.
We appreciate it. How are you? How's your team been at Care Patrol of Oakland County?
Doing good, actually. Pretty slow for the first 3 months of the shutdown, but in the last 2 months, it's absolutely gone crazy again. Getting really, really busy again.
For those who are unfamiliar, could you just give us a little overview about what Care Patrol does?
Yes. Care Patrol is a free community service. We offer placement services for families, their loved ones, seniors themselves. We help place people that can no longer live at home, or they're just downsizing from a larger home and they no longer want to care for it or can't care for it. So they want to move into a community of seniors that are like them. So anyone 55 and older, we help to find placement, and we really tailor it to their personal needs. So financial, location, whatever their individual care needs are. So it could be an independent living community, assisted living, memory care, or even the smaller adult foster care homes, which are really, really great for people with memory care or Alzheimer's needs. So depending on the level of care really dictates, what we recommend to our clients.
our senior care facilities have had a really rough time during the pandemic, particularly in the state of Michigan, where there's, of course, been issues with putting COVID-19 patients after they leave the hospital in nursing home facilities, of course, where they are not necessarily in close proximity, but in the same building as nursing home patients, and that may lead to a further spread of COVID-19. It's been a little bit of, at first necessarily it was maybe an impossible scenario, so to speak, where there's nowhere else for these patients to go, so they send them to nursing homes, and that creates other issues. In terms of how the pandemic has progressed over time, were these senior living facilities and these nursing homes put in an impossible scenario, or was there something more that could have been done to help prevent some of these issues?
Yes, I'm pretty passionate about this issue, actually. I really do believe that, when the governor had the two off-site hospitals built, one in suburban collection over Novi and the other one was downtown, they should have utilized those rather than forcing the nursing homes and rehabs to take these COVID positive patients. Because in the very beginning of the pandemic, in early March, even prior to the statewide shutdown, nursing homes and all of the assisted living facilities, rehabs, they had already shut their doors. So the last week in February, once this pandemic was kind of a global situation, and as Italy was evolving, all of our local Oakland County skilled nursing facilities and rehabs, they shut their doors to vendors like myself, outside visitors, family members. They really had it locked down well. So I have to give them a huge shout out and kudos to the owners, the managers of all of these different companies that decided that they were going to keep their current residents and patients safe. That's what they did. Unfortunately, rather than sending to these field hospitals, which we spent millions building, the governor decided to force the issue of having discharges directly into any skilled nursing or rehab that had less than an 80% total population at the time. Now, the reason they had low populations is because they were discharging patients and not accepting new ones because they wanted to protect their current population that was living in these or being treated in these skilled nursing rehabs, assisted livings, memory cares, and they were doing a fabulous job. So, I guess it's everybody's opinion, but in my opinion, had we not forced that issue, we would have a lot more seniors that didn't succumb to this horrible virus, honestly.
Can I get your opinion on what are your thoughts about having or allowing family members to put cameras or some type of device to be able to check in with their loved ones, especially during the pandemic when they've been able to not have that one-on-one contact?
I think it's a great idea. I really do. I think it's okay to have families have access to their loved ones at any time. I think that the new legislation that Jim Runstead has introduced is great legislation. I've worked inside assisted living, memory care, skilled nursing facilities. Sadly, have seen some situations that were less than, I guess, admirable from, different people. So I think that, if it were my mother and she was currently in a facility, I would want to have access to her. And I think it would be great to have those cameras in there because the seniors really don't understand technology. And so even though you have a memory care person and you're putting a tablet in front of them to say, here, let's visit with your loved one, or look at them, wheel them up to the window and see them in between, it's not the same. And I think as, a child of a senior, I'm going to be 60, so if my parents were still alive, they would certainly be at that age where our average age is between 80 and 85 that we place, then I would want to have access and be able to see them, and what's going on with them, for sure.
Kari West with us. She's a certified senior advisor at the Care Patrol of Oakland County with us on the Oakland County Megacast. And Kari, what advice do you have for families right now who are in a situation where one of their loved ones is at the age where they need to be maybe considering moving into a long-term care facility or into a senior living facility to uncomplicate the daily rigors of life for that particular family member, what should they be considering right now as they're looking for a facility to put their loved one in, as they're considering the ongoing pandemic? What should be going through their mind? What should be the first few things that they are thinking about before they take any action?
Well, first of all, I would get someone like myself or, Michael, my partner, to give you what's available out there, because we know 24/7 the communities, what their occupancy is. We also look at their state licensing. We do not partner with any providers that are not licensed by the state of Michigan, which is hugely important because our state happens to be one that does not require all adult foster care communities to be licensed. That is number one in our mind, because you need that state oversight to make sure that they're having those drop-in, anytime visits by the state to go in and make sure that the care and the licensing is all in order at all times. And we do that. We've got our clients and our providers to make sure that they're doing exactly what they're supposed to be doing by the guidelines and the rules, governed by the state. So that's number one. Number two, make sure that there's a good ratio of caregivers to patients. Sadly, the entire healthcare industry right now is dying for healthcare workers. We are very low, and so you want to make sure that if you're considering a community, to find out if in fact they do have a full staff, because staffing problems are rampant right now in healthcare, whether it's the hospital, the rehab, the skilled nursing, assisted living, memory care, all of it. And then thirdly, does it fit into your price range? No assisted living or memory care in Michigan is covered by insurance or Medicare. It is all private pay. The only thing that's covered is skilled nursing after a hospitalization or rehabilitation after a hospitalization or a surgical procedure. Everything else is going to be private pay, and that can run anywhere from $3,500 a month to $14,000 a month, depending on what type of facility and the level of care that your loved one might need. So that's where it really comes into play, the importance of working with somebody like Care Patrol so that we can really guide you and help navigate that world for you.
And Kari, what advice do you have for these senior living facilities and these nursing homes going forward as they're continuing to battle through this COVID-19 pandemic, continue to provide the care that they need to be providing safely to their customers, and as they're maybe bringing more people, new people, into their facilities going forward?
It's really a matter of safety and security, in my opinion. I really believe that, they're doing a great job now. PPE is readily available again. Thankfully, we don't have the shortages we had in the beginning of the pandemic. And so they're really focusing more on infection control, infection prevention, really, by requiring family members, even vendors like myself, anyone entering and exiting the building to wear PPE or protective equipment, masks, gloves in some instances, and even to wear the full
gowns.
Okay, gowns, and even face shields. Face shields are great for seniors, especially with memory care needs, because they don't understand why they have to wear a mask. And the face shield is like a visor that runs around your head, and then you have a complete plastic, shield in front that comes all the way down to your chest. So even people with glasses or people with breathing issues, which a lot of seniors that might have had COPD or congestive heart failure, they really can't breathe with a mask. So those are great options for people, and the communities are now making those available to their residents, which I think is a really good thing to do, because everyone has to be protected. Seniors are the most vulnerable. They have many comorbidities, which means they have underlying disease. Even before they get the flu or COVID, it makes them much more vulnerable to this type of thing. So safety and security is number one, always.
Kari, anything else for us before we let you go today?
No, just, I would say it's a fearful time for everybody, but we can do this safely. And if you're working with someone like Care Patrol and you're trusting someone like us to treat your loved one like they're our own and place them in a community we would place our own moms and dads and aunts and uncles, I think you're okay. You should be fine to place your loved ones. Isolation's a big issue. We don't want to leave these seniors alone, and living in a community to get that socialization with their own peers in a care setting where they can thrive. So really, it's always a positive. And people mostly say to us, I wish I would have done this sooner. So that would be my advice.
Well, Kari, thank you very much for being with us.
Thank you so much for having me.
We appreciate it. Kari West with us. She's a certified senior advisor at Care Patrol of Oakland County with us on the Oakland County Megacast. And good to get her perspective, Ronnie, about these different issues that affect both the people that are clients of these senior care and nursing home facilities and the facilities themselves as they continue to tackle these really complicated issues within the issue of COVID-19.
This is one of the hardest decisions for people to do, is to put one of their loved ones in one of these facilities. And during this pandemic, not having access and not being able to check on them yourself or to see how they're doing has been such a stress. So to get someone's perspective of who's inside this industry is so important and such a good service. And one of the big things, like she said, is you don't want to isolate the family member, and even you as as someone who has a loved one in a facility, be sure that you're reaching out and talking to other people so that everyone can talk and work together through these problems to come up with solutions.
Well, as we continue through the pandemic, we're looking for different ways to stay active in the community and to recreate with arts and sciences and other forms of entertainment out in the public, not necessarily just at our homes. And so we'll get an update on what some local museums are doing to reopen now to the public safely coming up after this break. We'll be back in just a moment. You're watching and listening to the Oakland County Megacast on a family of TV and radio stations.
Hi. My name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green or blue.
But one thing we can all agree on to help stop the spread of COVID-19. Wear a mask.
Wear a mask.
Wear a mask.
Wear a mask. Wear a mask.
The ball's in your court, Michigan.
Welcome back to the Oakland County Megacast on a family of TV and radio stations all throughout the local Oakland County area on Birmingham Area Municipal Access and Civic Center TV on Comcast Channel 15 and AT&T Channel 99. In addition, we're online in high definition on CivicCenterTV.com and on the Facebook page of Civic Center TV as well at Civic Center TV 15. In addition, we're on two great community radio stations, 89.3 Lakes FM in West Bloomfield, Keiko Harbor, Orchard Lake, and Sylvan Lake, and on 88.1 WBFH, The Biff in Bloomfield Hills, Bloomfield Township, and those surrounding areas as well. And we thank each and every one of our community outlets for joining us every day, Monday through Friday, 10 a.m. to 12 noon, here on the Oakland County Megacast as we continue to tackle the COVID-19 pandemic and how it's impacted people all across the board in a variety of industries, including in recreation, in those places, including museums in our local area. And we've previously had Amanda Harrison-Keeley with us on from the Detroit Institute of Arts, and we join we're joined once again by her today. Amanda, thank you for being with us.
Tyler, thank you for having me. It's a pleasure to be here.
Appreciate having you on. The last time we spoke to you, the Detroit Institute of Arts was closed. It was still early on in the pandemic. They had just begun doing a variety of virtual programs. Has the DIA reopened to the public now, and what does that look like if it is reopened, in terms of maintaining social distancing and other COVID-19 safety measures?
Absolutely. After closing our doors nearly 4 months ago, I'm so proud to say that the Detroit Institute of Arts has reopened for visitors, and we have new safety protocols in place that I'd love to share some of those with you so that way visitors know what to expect.
Sure.
So tickets are temporarily free of charge for all visitors. Beginning in August, general admission fees will be reinstated for visitors who reside outside of Macomb, Oakland, or Wayne counties. This is because those living in Oakland, Wayne, and Macomb counties always have free admission. And we're so grateful for the patience and understanding from visitors during our closure, and now as we reopen under some new procedures. So visitors can expect reduced operating hours. This is to allow us more time for cleaning each week. And those new hours will be 9 a.m. to 4 p.m. Wednesday through Friday, and 10 a.m. to 5 p.m. on Saturday and Sunday. And then we're also offering a special hour from 9 a.m. to 10 a.m. Wednesday through Friday for any of our high-risk visitors. A couple of other things to expect is that advanced timed tickets are required, so you'll have to reserve your spot on our website at dia.org. This is because our visitor capacity has been reduced, and the specific locations and galleries are being controlled. There's only one designated entrance for visitors. This is our Fernsworth entrance between Woodward and John R. And I think some of the obvious things, face masks are required. Temperature checks will be done at the door. Social distancing will be enforced. The cafe and Kresge Court are closed, so please don't plan to come down to have lunch. With that, no bags are permitted, and we're not offering coat check. Luckily, I don't think any of us need that at this time.
Amanda Harrison-Keeley with us. She is the Community Engagement Manager for Oakland County at the Detroit Institute of Arts. And Amanda, we previously had spoken about virtual programming from the DIA. Is that still ongoing now that the facility is reopened to the public, and in what capacity are those virtual programs still running?
It certainly is. We are not offering any in-person programming at this time, so everything is virtual or analog. We're still hosting our Thursdays at the Museum program every Thursday at 1 p.m. This is being led by your own Township Trustee, Howard Rosenberg, with a special guest each week, taking an inside look at artwork within the DIA's collection and sharing stories behind the paintings that we all love. We're also offering virtual school field trips and resources for parents and students to utilize at home. We have a variety of Curator talks on our YouTube page. We're offering art making resources, and one of the most popular things is our Detroit Film Theater recommendations. I'm actually excited to say that next Thursday, July 30th, we'll be showing a film for the first time as part of our Thursdays at the Museum program. That is going to be a free film for residents. It's called The Mysteries of Picasso, and we will be doing an interview with our own Elliot Wilhelm before the program.
Amanda Harrison-Keeley was with us on the Oakland County Megacast. She is the Community Engagement Manager for Oakland County with the Detroit Institute of Arts. Also going on, the DIA just began its Inside Out installations, which brings reproductions outdoors of different art displays. Could you give us some information about the Inside Out installations, Amanda?
Yes, I'm so excited about this project because if you are not very tech savvy and you don't want to do or engage with us online, or you're not comfortable coming to the museum yet, we are bringing reproductions of the DIA's artwork to your community. It's now in its 11th year. The Inside Out program, if you're not familiar, it's high quality reproductions of our artwork in outdoor locations throughout the Tri-County area. In Oakland County right now, we have 9 different locations and 75 works of art. Some of those works of art are brand new to the Inside Out collection too. We have added photography from Russ Marshall, and my personal favorite in the DIA's collection, Love Flight of a Pink Candy Heart by Florine Stettenheimer. We have reproductions on OCC's campus, Oakland Community College, and the Orchard Ridge is probably the closest one to you, or the Highland Lakes campus. So you can see some of those reproductions there, all outdoors.
All the programs that are coming up, people want to get involved too in the DIA. They love working with the artists and working with the Institute as they bring forth different programs going forward. And one of the other upcoming programs as we approach the fall is Ofrendas, celebrating El Dia de los Muertos, which features altars dedicated to lost loved ones designed and built by members of the community or community groups. How can people in the Oakland County area get involved in that project?
Oh, thank you for asking. This is a great program. We're in our 8th year of offering it, and we have, due to the current unique circumstances under COVID-19, we want to ensure that anyone who'd like to honor someone is able to send in a proposal. So we've extended our deadline for that through July 22nd. So if you know of, or if you're interested in applying to be a part of this excellent program, please do so at dia.org/Ofrendas Proposals 2020.
Amanda Harrison Keithley with us. She's the Community Engagement Manager for Oakland County with the Detroit Institute of Arts. What other programs are on the outlook in the coming months that are being either developed now and maybe coming up shortly, or be coming up in several months down the road, of course, with COVID-19 in mind, that may be of interest to people here in Oakland County?
So we are starting to look ahead to fall, and a lot of our programs don't easily, or quickly, I should say, translate to virtual programs. So we have decided that our popular Concert of Colors will be a virtual program. We've been working very hard on that to be ready for fall, but it will air on television. So please keep an eye out for that. We'll have updates as we progress at dia.org.
Well, Amanda, we thank you for being with us. You're also a member of the City of Rochester City Council. Can you provide us a little bit of an update on how the City of Rochester has been faring during the pandemic?
Certainly. Let me just switch my hats here quickly. We have, as you might know, we have a very vibrant downtown in the city of Rochester. So a lot of our businesses and our restaurants have reopened. We are, of course, enforcing social distancing. Our restaurants are at a 50% capacity. But it has been, people seem to be happy and following the mask requirements that are in place. Our farmers market is also open for business every Saturday morning, I believe from 8 a.m. to 1 p.m. And free parking is free in downtown Rochester right now, so there's no need to pay. I'm also proud to say that we're offering a senior concierge service. So if you're a senior living in our community, you don't feel comfortable coming to City Hall to say pay your tax bill, we'll actually come to you if you need us. And that has been really successful and popular. I'd also like to just plug, as a city official, I think this is important across the board, wherever you live, is that if you haven't yet, there's still time to complete the census, which is so important, and you're still able to register to vote for August 4th election coming up.
Amanda, thank you very much for being with us today. Anything else you'd like to touch on before we let you go?
Well, I am still luckily working from home, but I'm anxious to get back to the museum, and if you are too, I hope that I'll see you there with our new face masks.
We appreciate having you on today, Amanda.
You have a great day, Tyler.
You as well. Amanda Harrison Keithley with us on the Oakland County Megacast on a family of TV and radio stations all throughout the local area as we get a look into some of our local organizations and institutions reopening and what capacity they're reopening in. And interesting to see that the DIA is going to continue a lot of those virtual programs while gradually allowing people back into the Institute with limited programming as people want to get out and they want to experience the museum in person, because it's different to experience art on site right in front of the naked eye as opposed to on the web or in a virtual program.
You know, so many times we forget that we have these amazing things in our backyard. The DIA, for anyone who hasn't gone in person, take this time. If you are furloughed right now, if you are working from home and you have a little bit more free time during the day, now is the time that they're back open to go ahead and enjoy this asset that is in our community. They have some amazing pieces that we forget are right here. You don't have to go to, Europe or to Paris to see some of these incredible works of art. They're right here in our backyard. And it's like you said, virtual is great, but going to see the in person is such an experience and you get so much more out of it. So take advantage of there not being the crowds that you would normally have at this time of the year to go and explore the DIA.
There's so much knowledge out there in so many different places across the Oakland County area and across southeastern Michigan, and with residents of Oakland County being able to access these DIA resources for free as a partnership between the Tri-County area, especially now when you're looking for safe recreation and fun recreation. That's an institution that provides so much knowledge to the community and so much historical knowledge to the community. We definitely would encourage you to look into what you can do to support the DIA while you're patronage and going down there if you can and if you feel safe to do so. But there's also plenty of programming for you to engage in at home as well from the DIA, and we appreciate Amanda's insights into all of that. Other institutions in our community that have been gradually reopening include institutions such as libraries, and we have our own Erica Jones at one of those local libraries now to give us an update on how their progressive reopening is going. Erica, where are you at today?
Hi, Tyler. So I'm at the Bloomfield Township Public Library, and I'm very excited to be here today because we've been staying away from libraries kind of throughout this whole pandemic just because they've been closed and there hasn't been much to report other than curbside services. But I'm excited to announce that the Bloomfield Township Public Library, as of last Monday, July 13th, is now open for 30-minute appointments. You don't necessarily need to make an appointment, so you can now come to the Bloomfield Township Public Library inside to check out books, speak with librarians, use their computers, make photocopies. So pretty much all the services that they would normally offer, they're offering again, but social distancing. Although they do have that, they're still can get comfortable yet going inside the library.
Erica, are there any regulations in place with their having those 30-minute appointments? Are they blocking those out back to back, or to your knowledge and from whom you've spoken to, are they providing buffer times in between those 30-minute periods to cleanse the areas that were used and prepare them for the next person?
Yeah, that's a great question. To be honest, I did not get an answer to that. I don't necessarily think that there are times in between because it's not necessarily a specific area that you make an appointment to go to. Like I said, you're able to just go in and check out books and speak with librarians. So I think that they are periodically cleaning off computer desks and things like that. And I'm sure all the shelves, but I think the appointments are back to back. They do have limited hours now. You can see on their website the hours, but it is Monday to Thursday. They're open from 10 a.m. to 7 p.m. Friday until 6:30, and then Saturday till 5:30, and Sundays they're not open at all. So the hours are limited, and I'm sure that's because they're spending more time when they're closed so their employees can clean. But other than that, within those hours that I mentioned that you can also find on their website, I think you can make an appointment or walk in whenever necessary. And although it is still very early in the morning, they just opened about an hour and a half ago. I have seen, as I've been here, lots of people coming into the library. There's no one walking in right now, but as you can see, I'm here. The parking lot has a good amount of cars in it. And here is the front entrance. They have a very, very beautiful front entrance here at the Bloomfield Township Public Library. And it looks like people are very happy that they're reopened again for 30-minute appointments.
Well, Erica, thank you very much for that report out in the field. Erica Jones with us on the Oakland County Megacast, as she is each and every day, and we appreciate that report as she checks in with some of our local libraries as they're continuing their reopening in small capacities, step by step, like many other organizations in our community. Well, we're going to cap off today's show after this upcoming break, talking to you about how you can continue to stay fit during the COVID-19 pandemic. There's so many different virtual programs and efforts that have been put forth by local gyms and by local trainers. But with the summer months being so much hotter and people wanting to get outside, you want to also approach your fitness safely. We'll talk to Desi and Victoria Johnson from Des 2 Fit once again after this break. You're watching and listening to the Oakland County Megacast on our family of TV and radio stations.
Michigan, we still need to stay careful, because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, the coronavirus pandemic has put us all to the test, and now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast on our family of TV and radio stations all throughout the local area. On Comcast Channel 15 and 19, and Comcast Channel 15 and AT&T Channel 99 on Civic Center TV and Birmingham Area Municipal Access, as well as on 89.3 Lakes FM and 88.1 WBFH, the BIF. Both those services, Lakes FM, a service of the Greater West Bloomfield Cable Communications Commission, and the BIF, a service of the Bloomfield Hills School District, and we appreciate them being with us each and every day here on the Oakland County Megacast as we talk about a variety of topics related to the COVID-19 pandemic and other top stories in the area. And it's a summer. It's nice. It's been beautiful weather outside, albeit kind of hot and humid over the last couple of weeks. But people continue to want to engage in fitness with gyms closed and with the weather outside being so beautiful. But you want to make sure you're doing it effectively, make sure you're doing it safely. And to talk to us about how to do that in an effective way, we're joined now by Desi and Victoria Johnson from Des 2 Fit once again on the Oakland County Megacast. Desi, Victoria, thank you for being with us today.
Hey, good morning. How are you? Thank you for having us.
We are good. It's been a little while since we've last spoken to you. How have things been? Of course, with the pandemic in mind and the virtual fitness classes continuing on.
It's been going pretty well. I mean, it's definitely a learning process. We're able to really engage our people in a way that we haven't before. So it's going very well.
So are you able to do any in-person classes as of late, with outdoor fitness now being permitted in certain groups, or are you continuing to just go by virtual out of an abundance of caution and out of convenience, with people now being maybe used to doing that?
Well, we're actually now, with COVID, obviously the gyms are not open, so we haven't been in the gyms. But fortunately for us, over the course of the last few months, we've basically created a brand new platform. And our platform now is online, virtual, and we are also doing social distancing fit camps as well. So we're doing basically all three right now. So again, do we miss the gyms? Absolutely. Has it been challenging? Absolutely. Is it a new norm? Absolutely. But we're creating our own new norm, with everything that's kind of going on right now. So we're doing it all.
Well, you're obviously fitness enthusiasts, and this is also your business. And a lot of businesses during the pandemic have had to pivot and have had to make changes and modify their operations. How much of a learning curve have you had to experience, and how has that made you a more effective business leader in the community and made your business more successful maybe in the process?
Well, as you know, we had to go virtual for the first time. Before our classes were always in person. So the biggest learning curve was learning how to, give that experience to our clients in the same way, that we were in our classes. So, to engage them and, get them working out and staying in shape so they don't get into the lull of not working out. And then with our classes, when we did start doing them in person, it was a little different because we have to make sure our people are spaced out. We make sure we take temperatures when they arrive. It's just the process is a little different. So just to make sure everybody stays as safe as possible while getting that workout that everybody needs.
Absolutely. And then we even had to, obviously adjust, of course, we're primarily a corporate wellness company. So we actually design corporate wellness programs for different community groups, different, corporations, whatever it may be. So that was a bit of an adjustment as well, because most people now aren't working in the big, they're not working at the corporations anymore. They're unable to have the large, big group meetings. So when it comes to us, coming out to do our educational seminars, coming out to teach our big camps and things like that at Metro Detroit corporations all over, haven't been able to do that. So we had to actually adjust that platform as well. And we're now a virtual corporate wellness organization at this point as well. Going back to your initial question, have we been impacted? Absolutely. But this has actually made us a much stronger company, because now we have a clientele that's national. We have folks doing our classes all over the country. We actually have a couple out of the country that's doing our classes now.
So it made us way more accessible to more clients. Yes, definitely.
Desi and Victoria Johnson with us from Des 2 Fit on the Oakland County Megacast. Desi, Victoria, as we've continued on through the pandemic, we've gone from, of course, midwinter in the months of March in through the spring in April and May, and now we're in the thick of the summer months where it's really warm outside. People are going back outside because it's nice and sunny, and they want to get their exercise outside, whether it be through going for runs or playing on a playground or doing their regular workouts outside in their front or backyard. But during the months, you have some issues with heat exhaustion and other issues that may come up health-wise. What are you consulting with your clients and with people that you train to be able to access the outdoors and engage in their fitness programs, but doing so safely during this time of the year?
All right. Well, we definitely keep an eye on the weather. So there were a couple days that even though sun was out and it was beautiful, but we had the heat advisories. So in cases like that, we make sure we stay abreast on what the weather's going to be like. And we actually just went totally virtual those couple days because we didn't want to risk anybody coming out and, further working out while it's, 90 plus degrees outside. We also, when our clients do come to classes too, we bring bottled water, nice cold water so people will have something to drink. We always make sure our clients, take breaks when they can during the classes and making sure they stay hydrated. So when it comes to these real hot weather months, we really sure we try to stay on top of our people and make sure that they're taking care of themselves, because of course we want you to come out, sweat and do the work, but we also want you to be safe while doing it.
Absolutely. So worst case scenario, if it happens to be a class where it's absolutely just too warm to get the workout in outside, we are doing it just straight virtual. So our clients have access now with our programs where they can make the decision if they want to meet us at the park to do the social distancing fit camps, or they have the opportunity to tap in via our online virtual platform. So they have the opportunity. And going back to it, we're an educational corporate wellness company first. So we're making sure we have the conversations with our fitness family is what we call them, just to make sure that they know what they need to be doing to make sure that their body is prepared to work out no matter what the temperature is.
Desi and Victoria Johnson with us from Des2Fit on the Oakland County Megacast. You work with a variety of people, and in doing so, you're working with people that are at various levels of fitness and at different points on their fitness journey. For those that maybe are considering starting a fitness regimen right now, especially at this time of the year where it's really nice out, they can go for a walk, they can go for a run, and they can be but they can still be cognizant of their own body and their own development. What suggestions do you make for people as they're taking those first steps and developing a fitness regimen for themselves to get themselves into shape?
You know what I would say? You want to handle that one?
I mean, listen to your body. I mean, first off, congratulations that you want to take that first step in getting your body, getting your fitness a priority. But that number one thing I always tell everybody in class, always listen to your body. Just because the person next to you can, maybe do a push-up better than you, I mean, it's okay. I mean, your body has to get stronger. It has to learn. Your muscles have to learn the exercises and everything like that. So you always go to the point of what your body, tells you just naturally, this is as far as I can go. And that's why we also, what makes us unique is that we, between the both of us, someone's doing a more advanced move and the other one is doing the modification. So we are always showing the beginner steps of certain exercises to ensure that, this is where you start and this is fine if this you are, and then you transition up into the more advanced moves as you move along.
So no matter if you're coming to a class with us teaching, or no matter if you're going to a class with one of our trainers teaching, we're all National Academy of Sports Medicine certified trainers, as well as the American Council of Exercise as well. So we understand that there's so much. I mean, there's chronic diseases, there's injuries, there's everyone is on a different level. So therefore, we make sure that our fit camps and our programs are designed for a beginner, for someone that's intermediate, as well as someone who's really been in it a long time, because we want to make sure everyone enjoys themselves, no matter what class or what fit camp you decide to do with us.
And beyond just general health, fitness is so versatile in that it helps build confidence, it helps build motivational techniques, it helps you develop different strategies in your regular life on top of what you're doing necessarily in your workouts to help you through different challenges throughout the daily grind of life. How can a fitness program help change somebody's life, their mind view, their day-to-day operating procedures, especially in a time like this where there's so much stress and there's so much anxiety and so much uncertainty about what's going forward? How can a fitness regimen now help somebody going forward?
You know what, and it's so interesting that you bring that question up. Again, we go into corporations, and what we do is we help those corporations design a fitness culture. So part of designing a fitness culture, it does a few things, right? You touched on them. It builds confidence. It maximizes productivity. It helps them build a stronger relationship. It helps them structure their goals. It makes them focus. So right now is really, it reduces stress. Yes. Right now is absolutely the time, because again, we're dealing with something that's very, very unknown. We're dealing with something that's extremely at high stressful. And with that being said, it's fitness helps you manage and get through that. Would you agree with me on that?
Oh yeah, absolutely. I mean, it's a great de-stressor, and that's probably the biggest thing that people, get into a fitness regimen that can really help, balance that out, because everything is so have no idea, what every day it seems like the normal is always changing on what, we have to do and what's to come. So if you can have some type of routine with your fitness, that could be something in your control and can definitely help, keep a structure to your day and help you balance all that extra stress that's going on right now.
Desi, Victoria, anything else you'd like to touch on today before we let you go?
Well, right now, again, we talked about this being a very stressful time, a very challenging time. I just want to let our community know that we're here for you. And again, we want to make sure, that it's very important that we stay on top of our health right now. Like, we're dealing with a lot of things like overeating. We're dealing with things where some folks are not taking care of themselves because of stress. Folks are having anxiety. Folks are having depression. Fitness really, really helps reduces some of those things. So again, we're in a community. We're open with open arms, and we'll be more than happy to have, free consultations with anyone that's interested to learn about how our fitness or nutritional products can help right now through this unknown, through this uncertainty. That's what we're here for. We just want to make sure we're helping our community and continue to push on through this together.
Desi, Victoria, thank you very much for being with us today.
All right,
thank you so much.
Appreciate it. Desi and Victoria Johnson from Des 2 Fit with us on the Oakland County Megacast all throughout the local area. We appreciate them coming on. It's always something different to discuss when it comes to fitness at different times of the year, because some people get into it for different reasons, and some people get into it out of convenience or out of wanting to try something new. And in their case, they're often using fitness in their business ventures with other companies to motivate their staff, to provide confidence to those staff members. And at a time like this, those factors are arguably as key, if not more key, than the general health and bodily factors that are benefited by a fitness regimen.
For so many people, fitness is a part of their day-to-day routine. And when you shake up that day-to-day routine, fitness can usually be the first thing to go, but it has so many side benefits as well. So as we are all having to realign and readjust our life during this time, it's important to get back into a schedule and to understand the importance of fitness and how to fit it into your new day-to-day routine.
There's so many factors, like Desi had said and Victoria had said, of our lives that are being changed by this and are causing stress. And a fitness regimen, whether it be going out for a walk every day, going out for a nature walk and calming down, or going for a run and getting that rush of endorphins, or lifting weights, or stretching, yoga, whatever it may be. If you're engaging in some sort of regimen and you're keeping that discipline, it is going to help you in other areas of your life. And so we appreciate the insight from Desi and Victoria Johnson. Just a couple more minutes left in today's program, so we're going to quickly go through our top headlines of the day. Union workers at nursing homes have planned to strike beginning today as they face significant health risk during the COVID-19 pandemic. Workers are calling for increased safety protections such as masks and gloves, and they want a $15 minimum wage for all service workers, an $18 wage for certified nursing assistants, an end to mandatory overtime and short staffing, and improved benefits such as health care and paid sick leave. They're asking for things that maybe should have been something considered a few months back, as this pandemic really took a toll on these workers, and now they're at a point where they can't maybe handle it anymore and are at a point where they have to put their foot down and say, while the times are decent and it's not an immediate need across the board for our services necessarily, we want to take care of these issues so that if there is a second wave, we know we're taken care of.
They're on the front lines of our loved ones that are in these facilities, and we want to make sure that they are safe, because if they are safe, then that makes sure that our loved ones are safe as well. So we have to do what we can to make sure that they have all the tools that they need to be able to do their job safely.
Lastly, an update on coronavirus cases in the Oakland County area and throughout the state of Michigan. Coronavirus cases continue to climb, with more cases of the coronavirus, but fewer deaths. That's been the trend the last few weeks in the state of Michigan. The state reported 483 new cases of COVID-19 and 2 deaths on Sunday, bringing the yearly total to 73,663 cases and 6,119 deaths. Last week, about 3.5% of COVID-19 tests in the state of Michigan came back positive. The rising number of cases is being contributed to people gathering at places such as churches, bars, and house parties, among other places. So we're still seeing a little bit of a spike throughout the state of Michigan. Of course, it's kind of leveling back down toward that mid 400 area, not quite as severe as the 891 cases we saw at the high point last week, but still a cause for concern.
Well, we are very happy not to be going through the situation that we were going through in March and April and what they are seeing in some of the southern states. We still need to maintain what we have been doing, it's been so easy to let our guard down. And I think I've been guilty of this. We've all been guilty of this. But we need to maintain it so that we can continue to go forward. Eventually, we want to get to that phase 5 so that we can start to reopen more businesses such as gyms. We are still currently in that phase 4 situation, and we want to get to phase 5.
And like Chief Flynn said at the beginning of the show, we've been through what we're seeing in Florida, what we're seeing in Texas, what we're seeing in Arizona. We've been through all that. We know how severe it gets. And I think that should be more motivation than anything for us to not want to go back. That is going to do it for today's edition of the Oakland County Megacast. For Ronnie Dahl, I'm Tyler Keefe, and we thank you on behalf of our entire team for joining us. Ronnie and I will be back tomorrow.